This medical moment is brought to you by St. Rita's Health Partners, the region's leader in healthcare.
Welcome back to First Edition. It is Colon Cancer Awareness Month, and to talk a little bit about how to check for that type of cancer is Dr. Wisser from St. Rita's Medical Center. Thanks so much for joining me.
Thanks for having me.
Okay, so let's talk about colon cancer. Who's at risk? How do we check for it? All those good questions.
Sure. Well, generally there's several risk factors, some of which we can change, some of which we can't. Age being one of them. Obviously, most of us wish we were a little younger than we are.
Yes.
But age is definitely a risk factor. Personal or family history of colon cancer is a very large risk factor associated with this. And then there are some things that potentially are changeable. High fiber diets, getting activity, and obviously tobacco is a risk factor for almost every cancer we know of at the moment.
Okay, so if you change your diet, that could help a lot too with preventing
that helps in
that
general.
type of cancer.
Yeah, there's a couple of theories behind colon cancers and what caused them. The general theory being toxins in our diet and our exposure to the colon affect how the colon reacts, and subsequently, either because of high toxin loads or not enough fiber in our diet clearing things out adequately, that has a longer time to be exposed to the colon and increases your risk.
Okay, so a colonoscopy is a screening to check for colon cancer, and it's very important. At what age should you have that done?
Baseline colonoscopies start at age 50 in people who are normal risk or don't have any symptoms, and earlier in patients who have either symptoms or family history associated with them. The biggest thing we see people, the largest symptom group associated with colon cancer is having blood in the stool, but only half of them do it. Now, that's not saying that all blood in stool is related to colon cancers, but that's our job to kind of prove that. I can't tell you how many times I've seen people who wrote it off as just having hemorrhoid issues and find out later on that it wasn't.
Okay, so very important. Get your screening, get checked out. Okay.
Very much so.
Thank you so much, Dr. Wisser.
You're welcome.
We appreciate it. We'll be right back.
Thank you for having me.
Yes.